And there's different types of each hernia and different types of symptoms for each hernia.
Of course.
What kind of symptoms are we seeing with hernias?
Yeah, the most common symptoms, again, usually pain, discomfort. The pain and discomfort can be exacerbated by physical activity, by heavy lifting. Now, when you get into more complex hernias, you can get constipation, you can have intestinal obstructions.
We have a graphic that's actually going to show us some of those common symptoms of, let's say, an inguinal hernia. And we can go through them and how common they are.
Well, pain and discomfort, I would say, is definitely the most common symptom. And definitely patients, when they see me, the first thing they mention is that it exacerbated by bending over, by getting out of bed, by getting up and out of the car. They usually feel a pressure or heaviness in the abdomen or in the groin. And sometimes when the hernia compresses other structures, for example, a nerve, they can get a burning or an electrical type of pain as well.
Wow. The burning pain is something that I hadn't heard of, so that's very common then.
It happens as well.
Now, one of the things that you also see in the ER as a surgeon is sometimes people wait too long and these symptoms get worse and you see them in the ER doubled over. And it's one of those instances where you say, you should have seen your doctor.
Of course, no. Sometimes when we see these patients finally in the emergency room, you know, they come in with unbearable pain. They come in sometimes very sick with intestinal obstructions or more complex problems such as what's called an incarcerated or strangulated hernia, which we'll talk about later.
Yeah, and one of the more complicated hernias, the hiatal hernia, we do have symptoms that can indicate and show a patient to get help right away because these can tend to be a little more complicated. And some of the symptoms of the hiatal hernia, we can go through them.
Yeah, usually the most common cause the most common symptom is usually acid reflux, heartburn. Some of these patients may have these symptoms even despite taking medication. They can get chest pain. Again, it can be easily confused for a heart attack, and sometimes these patients come in very scared thinking they're having, you know, a myocardial infarction. And down the line, they can definitely have a lot of difficulty swallowing and regurgitation.